I feel I might. No. I know I have a case. I can't imagine a world where a doctor tells a patient to lie and then nothing happens to him. I know I've talked about a few things that my neurologist has done and said, but trust me, that is just the tip of the iceberg. Well, first, let's just say this. Yesterday was my birthday, and Justin showered me with love, and he bought me so much equipment for my YouTube channel. Yesterday was a very good day. I celebrated with my mom at the shop. Today, not as good. Because I got a phone call from Cook this morning, they unfortunately told me that the medical leave forms that was returned from my therapist was not filled out to their satisfaction. I think they needed my permission to move forward with their decision, because after they told me that my therapist could not give them a date, the same as my neurologist couldn't give them a date, they asked me, do you agree that you are not able to return to work yet? And I went silent. I didn't know what to tell her. I didn't know if I should tell her, my doctors had not been giving me adequate care, which is why I'm not in the place to return to work just now. In that moment, I kind of figured that no matter what I told them, it was not going to matter. I would probably have to dispute this somewhere else other than this phone call. And very reluctantly and hesitantly, I told them, yeah, I guess so. It was pretty obvious that they've made their decision before they even called me. She did have sympathy on me. It wasn't like she was happy to fire me. Sorry, I had to get some coffee and some birthday cake because I'm getting all riled up. Okay. I can't believe how long it took me to get cake because I completely forgot what I was talking about and now I can't leave off where I ended. So, sorry, but I'm just gonna move on to my next topic. Birthday cake. This coffee tastes like I need to clean out my coffee maker. It's not your fault. I know Cook is finalizing my termination today. I know why they terminated me. They have been very gracious and very patient with me. It's astonishing that they held on for as long as they did. I can't see any other company doing that for someone. But I feel like my termination, or at least their decision to terminate me because no other option is possible at this point, I feel like that could have been avoided. If I was given the right treatment at the right time and taken seriously at the beginning, I feel like a lot of stress and frustration and terrible depression could have been avoided if only the people that were meant to help me actually helped me. Like, I really feel like I've had to fight my doctors this whole time. And not because I'm an irresponsible, incompetent patient who doesn't know what she's talking about. It's because I'm not receiving anything. Like, this whole time, it just feels like, are you ready yet? Are you ready yet? Are you ready yet? I don't wish this kind of experience on anyone. No one should realize that there are so much treatment options out there at their fingertips, but for some reason they were never informed that was for them and that was something they needed. Well, since there's no way or reason for me to return to the Cook Clinic, I want to discuss why my blood is boiling over how these doctors have treated me, my family, and my situation. I know I've talked about a few things that my neurologist has done and said, but trust me, that is just the tip of the iceberg. I feel I might. No. I know I have a case. I can't imagine a world where a doctor tells a patient to lie and then nothing happens to him. I'm going to start in the very beginning when I was first put on medical leave and that medical leave was about to expire, and I was going to my physician to talk about getting a new medical leave approved or getting my current medical leave extended, and he refused. This was still the point in time when I was having seizures, I was having tremors, I was still in a wheelchair. I'm not exactly sure when my spells started. I know that it was while I was on medical leave, but I believe this is when my spells were just beginning, and I didn't mention it to him because I didn't know what they were just yet. Yeah, so this is when I was still having all of the symptoms that brought me onto medical leave in the first place. And for some reason, my physician didn't want to extend my medical leave. He just kept thinking that this is anxiety. I think I was on Valium. Yeah, so since I was going to therapy and taking Valium, that I was going to be fine, and he wanted to push me back into work the very next day. I remember this because it was a Thursday, and he wanted me to return to work literally the next day on Friday. The whole visit was terrible. I was very disappointed that my physician was refusing to extend my medical leave, even after I told him why I can't go back to work just yet. I even had my sister-in-law with me, and she was telling him the exact same things, and he was not listening to her because in his mind it was still just anxiety. This is all panic attacks. About 2 hours after that visit, my physician called me himself, not one of his nurses, himself. He told me that he feels I'm hesitant to go back to work because I'm afraid of what my coworkers will think, given that all of my tests at that point were coming back normal and that so far nothing physically wrong has been found. I told him, no, I'm hesitant to go back to work because I'm still having seizures, I'm still having tremors, I still can't walk. And he completely ignored me. Did not listen to a single word I said, because immediately after I said that, he jumped back into, okay, well, when you return to work tomorrow... This is just the beginning, guys. What I'm about to say is 100% true. He told me to tell my supervisor and my coworkers that I'm getting physical therapy at the YMCA. Here's the problem with that. I never received physical therapy. I never went to the YMCA for physical therapy. I was never told to get physical therapy. I was in a wheelchair, and they never told me to get physical therapy. And now my physician is telling me to lie to anyone who asks, including my supervisors, that I'm getting physical therapy at the YMCA. I told him I don't even have a membership to the YMCA. I'm not getting physical therapy at the YMCA. And he goes, oh, you aren't? Oh, well, maybe you should do that. So the weeks that I was rolling into his office in a wheelchair, he never once bothered to tell me to get physical therapy. But when he tells me to lie, that's when he tells me, oh, you should probably jump on that. I'm not gonna lie, I felt very disrespected. I felt like he could not care less about my situation. To be frank, I really thought that he and Cook were like in this together to get me to come back to work as soon as possible. I don't know why I thought that, but that was like one of my reasoning as to why he could possibly think this was an okay thing to say. Like, do they want me to get better or not? Do they want me to receive help or not? So obviously I called Cook. For some reason I didn't tell them what my physician told me. I just told them that my physician is refusing to extend my work leave. So they gave me a grace period so I could get some kind of work leave renewed. Talking about my work leaves for a second, in the very beginning, I had to fight for my first 2 medical leaves to be extended because I was obviously not ready to go back to work yet, and for some reason, they all wanted me to go back to work. After that second time, they were mysteriously just extending my leave without even telling me. No one from the Cook Clinic reached out to me to tell me, hey, your leave has been extended, just to let you know. I don't understand why no one told me that my leaves were extended. I don't understand why I had to find out and call people. It feels to me that they were just really done with me and they were like, yeah, whatever, just give her whatever she wants. Like, she fought the first few times, just shut her up, just shut her up. And of course, the whole issue about the first neurologist that I saw, you know, the fact that I had a seizure on his EEG table during the EEG test. I wet myself during that test. He never made a follow-up appointment with me, never returned my phone calls, and then on top of that, about 2 hours, why is it always 2 hours? About 2 hours after that appointment, I got a phone call from his office saying that my EEG was fine and that everything was okay. More specifically, that no seizures were caught. I wonder why in that phone call they failed to tell me that a non-epileptic seizure was caught. I know the difference between an epileptic seizure and a non-epileptic seizure. I'm not an idiot. Whatever happened to honesty? I'm a 24-year-old, well-educated woman. I'm not an idiot. Why are my doctors treating me like I'm an idiot? And then, of course, the whole thing with my second neurologist. Every single visit that we had with him was just me updating him what has happened the previous few weeks. All of the seizures, all of the spells, all of the tremors, all of the falls that I've taken. He also didn't tell me that there was a non-epileptic seizure caught on my EEG. There was a period as to when I thought that my non-epileptic seizure was caught on the EEG, but for some reason I thought, oh crap, that's not true, my EEG was fine, and I've been telling people this lie this whole time. So I called their office to make sure that I was not lying, and they told me over the phone that my EEG was not abnormal and everything was fine and nothing was caught. And I was right all along. Why do doctors lie straight to your face? Why did my second neurologist waste 3 weeks of my time not sending my personal files to the Mayo Clinic when I told him to do that? I want to make this clear. At his office, there was no specific paperwork that I had to sign at that moment for him to send my things to Mayo Clinic. Because when I went to his office that day to request that done, they didn't tell me, okay, just sign here and we can go ahead and do that. Me giving my permission over the phone was enough for him to do that. I don't know what you would call it. I don't know if you would call it mistreatment or negligence, abuse. Why did no one tell me I needed physical therapy? Why was that up to me to just figure out that I need to go get physical therapy? I'm in a wheelchair and I'm having seizures and my life is falling apart in front of my eyes. Why is it up to me to figure out what kind of treatment I need? Why am I told to lie to my supervisor and my coworkers just so that I can be shuffled back into work immediately? Why am I not told that my seizures were caught on my EEGs? Why was I not referred to the Mayo Clinic? Why am I being refused a refill on medication that was working for me? Why are antidepressants being shoved down my throat instead of the medication that was working for me? Is this a lawsuit? I think so. Do we have the means, the time, and the money to go after this lawsuit? Most likely no. And that's unfair. I can't tell you how many times I've laid in that bed thinking, what's the point? Doctors think I'm lying or they think I'm exaggerating. They're not taking me seriously. What's the point? There were some days where it was really hard to find the will to live. I felt like my doctors were either waiting for me to get better or to die. And it still seems that way. Today, it still seems that way. Even when it is FND and conversion disorder, there is a mixture of treatment that people have to go through. It's a mixture of medication and physical therapy and audio therapy, things that I didn't know about, things that I should have been doing from the beginning. I can't fit all of the disappointments and the confusing moments and the little nuggets of doubt that I've had with my doctors in this video. I mean, it's there are so many little things that just add up, There's just so many things that make you wonder, like, do they even care if I live through this? I can't today, guys. And on top of that, I got fired. And I lose my cook insurance. How many more, what if scenarios can go through my mind? What if I was taken seriously? What if I was receiving the help I needed? What if it wasn't up to me to, fix myself? That's how it feels. It feels like the doctors were just waiting for me to fix myself. Why did they leave it up to me and my family to go search these resources? The only resources I received from any and all medical professionals was just regular therapy. And you know what? I still had to find my own therapist because the ones that they provided for me couldn't even take me. No, I need to talk about this for a second because this is downright ignorance. In the beginning, when I was first being referred to a therapist, No, not referred, told to go find a therapist. They gave me a resource for the IU hospital for this outpatient program for therapy. I called the outpatient program, and because they're so backed up with so many patients already in Bloomington, they're not taking anyone outside of Bloomington, aka the outpatient program is full and they can't take me. Because the outpatient program is a group program, we will all be in a room together, which means, there'll be several nurses and several therapists working with a group of people at the same time. And they concluded that my case was so severe, I wouldn't be helped in this program and I would probably make things worse for other people, because if I started tremoring or seizuring or having spells, other therapists and other nurses would have to stop what they're doing with other people and to help me, which I understand. I totally understand. I don't want to hinder or interrupt anyone else's progress because of what I'm going through. But how stupid is it that the outpatient program is full and they're not taking anyone else, and I'm still told that's probably the only place I can go to right now? Why didn't the doctor call the outpatient program to see if they could take someone like me? Why didn't the doctor call the outpatient program to see if they're even taking people? Ugh. I'm thankful that I got into the Mayo Clinic. I'm so thankful that I'm gonna see them in February. But I'm disgusted that the majority of the help that I have received has been my own doing. I'm not even kidding. The last time I saw my physician at the Cook Clinic, he was trying to tell me that I need an antidepressant and then another medication that's usually used for bipolar disorder, but it helps with seizures. And I said, I understand that, but the medication that I'm taking now is usually for narcolepsy, but it also helps with seizures. And it's working for me with no side effects. My body's used to it. There's no side effects. And my physician just kept pushing, no, we need to put you on this medication, and the side effects are this, and this. I'm not even kidding when I tell you that all of the side effects were my symptoms. Brain fog, nausea, headaches, blurred vision, blurred speech. Wow. And I told my physician, why would I switch from a medication that is working for me with little to no side effects to a medication where literally all of the side effects are my symptoms? Doesn't matter if the side effects don't happen, I will still feel them in my symptoms. And I kid you not. 100% true. He said, if I don't want to take a medication that he is trying to shove down my throat, he can't help me? He can't look for other medications or let me stay on the medication that I'm currently on? I don't know, guys. I feel like this is abuse. I don't know what else to call it. I feel like it's no longer just ignorance or mistreatment. I feel like I have been gaslighted. I feel like I have been neglected. And I don't know if I can do anything about it. That's the worst part. I've reported 2 neurologists so far. And all 2 times they just keep saying, well, we can't really do anything about it, but talk to them. So basically my neurologists are just gonna know that I complained about them. Yeah, go ahead. Talk to him. Talk to him and let him know that I am dissatisfied with the service that he provided for me, and he will not lose an ounce of sleep tonight. But I have lost my sanity over the past few months. I'm just done, guys. If you haven't before, please like and subscribe to my channel. I'm sure there will be more infuriating updates to come, but I will talk to you guys later. Bye.